Thank you, Sheldon, for inviting me, and thank you all for coming. I mean, this is such an important issue for everybody. And let me talk to you a little bit about what it's like from a physician perspective. So, affordable, high-quality health care, really, as has already been said, is just a fundamental right of every American, just like public education. There's no difference. It's really a mark of an advanced society. And we're the only nation in the world who has, who's an advanced developed nation in the world, who doesn't have universal coverage. So we should be ashamed of that. The ACA was the most significant piece of healthcare legislation that's been passed when it did pass in 2010 since 1965 when Medicare was passed. And it's developed primarily by Congress and was based on keeping the private health insurance market, something that the Republicans talk about. Well, we tried to keep it, and that's what we have now. And there clearly is room for improvement, but it is something that, that we agreed to when initially it was put into place in 2010. So I think that I'm a practicing internist in southern Rhode Island, and I see the potential consequences of a repeal and having no health insurance on a daily basis. Healthcare is simply unaffordable unless you have healthcare coverage. Let me give you 4 examples. One is the cost of prescription medications. Most patients don't understand this, but if you don't have coverage, it can cost you $400 or $500 per medicine per month. And if you're on more than 1 or 2 medications, which many people are, the bill can be thousands of dollars, which is really unaffordable. And I have lots of patients who have diabetes and asthma and heart disease, and they simply could not afford their medication if it wasn't for the provisions of the Affordable Care Act. So the Affordable Care Act allowed about a 50% reduction in the cost of prescription drugs as a result of coverage, which would be basically removed if it was repealed. Let me give you the second example. The ACA banned insurance companies from denying insurance to people with pre-existing conditions. As Sheldon has mentioned, 27% of Americans, 27% of you here have a pre-existing condition, over a quarter of you. And that requires a lot of testing and a lot of treatment. And if you were to ban 27% of the population, then you are talking about a significant number of people who would be uninsured. Now, the ACA has also banned companies from placing lifetime limits and annual limits on health expenses. And for example, if you get breast cancer or you get colon cancer, you could eat up your lifetime or your annual limit probably within the first 6 months. So 6 months of then you're left holding the bag as far as any further expenses are concerned. And I think this is really unaffordable. It drives people basically to bankruptcy. And my final example is that many of you now are coming into the office that didn't come in before. And you're giving us an opportunity to really diagnose your problems earlier rather than later, to treat chronic disease, to do some preventive medicine, all of that, and possibly even avoid an emergency room visit or a hospital stay. I think everybody would be in favor of that. And that's something the Affordable Care Act has done that wasn't there before that. So another reason to retain the Act. If there is a repeal, 22 million people could become uninsured, and 52 million people who have pre-existing conditions would also be at risk of not being able to be insured. That's 164,000 people in Rhode Island with pre-existing coverage that will be denied, and uncompensated care would rise by $186 million in Rhode Island. And that's basically because hospitals would have to basically give uncompensated care. We in the office would have to give uncompensated because patients, as I said, simply can't afford the cost of health care. Now, there are definitely things that we need to do to improve it. There's no question about that. And we do need to look at the rate increases, and we do need to look at the deductibles, the high deductibles and the co-pays. But that's not a reason to dismantle the Act. That's a reason to improve upon it. So I'm the president, as Sheldon mentioned, I'm the president of the American College of Physicians, which is an organization that represents 148,000 physicians around the country. And we are going to hold Congress accountable, Congress and the President. We're going to hold Congress And let me tell you what we're going to hold them accountable for. 6 things. Number 1, will your coverage go uninterrupted in any replacement plan? Number 2, will pre-existing conditions be covered? Number 3, will there be no lifetime or annual limits on your insurance? Number 4, what will happen to the tax credits and the premium subsidies that people have to make health insurance affordable? Number 5, will Medicaid be will retain and expanded on? And number 6, as Sheldon mentioned, will the quality-based payment model that we have transformed to from just pure fee-for-service to more of a quality-based accountable care organization model where we are responsible for delivering high-quality care needs to be retained. So those are things that those 6 requirements will be needed in any replacement plan that the Republicans come up with. So there are issues. We do need to expand choice as far as consumers are concerned. We need to have more competition in the health marketplace. We know that. And we know that healthcare consumes $3.2 trillion a year. That's 18 to 19% of our gross domestic product. That's an issue. We need to address it, but not by repealing the Affordable Care Act. So in medicine, we have a saying that, first you do no harm. And really, by repealing the ACA, you will absolutely be doing a lot of harm. And by not replacing it, you're doing even more harm. And I think it's wonderful that we have these grassroots efforts because, again, I think universal coverage is a human right. Thank you. Representative Jim Langevin is actually my representative. In healthcare. He supported the ACA. He just voted against the repeal of the ACA. You supported NACA legislation. And you supported the Cures Act, which really expands medical research funding and brings new drugs to market. So, Representative Langevin.